Good afternoon. Good afternoon, everybody. Good afternoon to all of the people of Rhode Island. And thank you again to the members of the press who are working with us to get the word out. Information is power. Unfortunately, there's a lot of misinformation and rumor flying around on the internet and social media. So I would ask everyone in Rhode Island to do your best to keep yourselves informed and to go to official channels to receive your information. I want to begin, as I do every day, thanking everybody who is helping us, especially the folks at the Department of Health who are really the tip of the spear here, as well as all the healthcare providers in the community. I can't emphasize enough for our Rhode Islanders the level of stress that these folks are on and how hard they're working. So thank you to all of you. I also want to thank the people of Rhode Island. I've never been more proud to be a Rhode Islander. The expressions of kindness, patience, and generosity that I am receiving daily, it's overwhelming, it's heartening, it gives me hope, and it's what lets me say with confidence that we're going to get through this. It will be hard, it will be longer than any of us wants, but there's recovery at the end of this, and the fact that Rhode Islanders are really working together fills me with optimism and confidence as I address you this morning. We are now at 33 cases of coronavirus. We've had 10 new cases since our last press conference, and I'm going to leave it to Dr. Nicole Alexander-Scott to address that in a few minutes. I have a lot of news this morning, so I'm going to try to go through it deliberately and slowly, and then we're happy to answer any questions. The issue that seems to be top of mind for most people right now is schools. Many people are saying, what are we going to do about schools? After a great deal of thought, consideration, collaboration, and communication with teachers, superintendents, teachers union leadership, we have made a decision, and that decision is that for the next 2 weeks, from Monday, March 23rd through Friday, April 3rd, will be distance learning weeks here in the state of Rhode Island. I'm going to say that again. Starting Monday, for a period of 2 weeks, will be distance learning for all public K through 12 schools in the state of Rhode Island. After 2 weeks, we will evaluate how it's going, and then we will make a decision at that point as to what we will do for the remainder of the school year. I want to say this. This is a tough decision, and this will be tough to execute. Many other states have just thrown in the towel. They have said no more school for the rest of the school year. By the way, as you can imagine, my children are lobbying me to follow that. But I'm not yet willing to throw in the towel, because I think some learning is better than no learning. Oh, and I want to respect our teachers, as well as our principals, who are urging, let's go ahead and try this. I'm not going to sugarcoat it. This is different. It's never been done before. It's never been done before anywhere in America, not just anywhere in Rhode Island. But I think we're ready to do it. Let me give a few messages to everybody involved. Students, listen to me, students. This is not 2 weeks of extended vacation. This isn't 2 weeks to hang out with your friends, sleep until noon, and blow off school. This is learning from home, spending as much time, as much effort as you would if you were in school. So your teachers are going to be in contact with you on a daily basis. They're going to be giving you assignments. Some of them will actually be teaching courses online. We need you guys to pitch in. This is only going to work if it's all hands on deck. This is an all hands on deck effort. And so students, we're beginning with you. Take a few days this week to get a desk organized in your room, figure out a schedule that's going to work, and just get yourself ready for the next 2 weeks to learn in a different way, because school buildings will all be closed. We cannot safely open school buildings, so all school buildings will continue to be closed, so you're going to have to work from home. To teachers, I want to begin with a huge thank you. Thank you. Everyone in Rhode Island should know the yeoman's work that teachers have been doing this past week. We asked all of the districts to get to us their district learning plans to Commissioner Infante-Green. And many of you have, most of you have, and that's just been a lot of work. So I want to thank you for that. And I want to say, as you know, the hard work is to come. I know that many of you have never done this before. I know that you need and deserve additional professional training in order to get yourselves ready to do this. And I want you to know we're going to be there. We're going to do everything we can over time to provide you with the support that you need in order to help you deliver an education to your students in this way. I will ask you, just as I'm asking everyone, to put your all into it. It's not vacation. This isn't vacation. When school opens Monday, we need you working as hard as you would in a regular school day with school in session. Communicating on a daily basis with your students, giving out assignments, grading assignments, offering feedback to students, doing assessments, everything that you would do as a professional educator, doing it in a different way. I want to take a minute to especially acknowledge Larry Pirtle from the NEA and Frank Flynn from the AFT, both of whom are here with me today. We've been in constant communication. We're going to be relying on the professional associations, the unions, to help provide additional training and support for our educators as we go through this together. We're going to learn a lot in the next 2 weeks. We're going to try it. We're going to try it and we'll learn a lot. We'll be better at it at the end of 2 weeks than we are on Monday. And we're going to adjust. But from everything I can tell, from talking to parents and teachers and union leaders, the commissioner, of course, experts around the country, I've decided this is the right step to take at this moment in time to ensure some semblance of continuity in education for our students. For parents, I want to say thank you in advance because this is going to be rough. And I'm going to ask you please to do your part. Come up with a schedule, like what we're doing in my house with our kids. I have a high schooler and a middle schooler. You know, sit the kids down and work through a schedule. Make it clear to them that this isn't vacation. They all have to get up at a certain time and do a certain amount of homework. If you can, find a place, a desk where they can do their work. We're all going to have to do our part in order to institute some structure in our homes, since there isn't the structure that we're used to at the school. And again, as I said, I'm not trying to sugarcoat this. I know this is going to be tough, but I believe in us. I believe in us. I believe in our teachers. I believe in our parents. I definitely believe in our students. Every student I've ever met in the public schools, and I've been spending a lot of time in public schools recently, is hungry to learn. So let's make it happen. Rhode Island's the only state doing this now. Let's shine for the rest of the country to see what we can do here in Rhode Island. And again, RIDE is going to be providing constant support. We're already reaching out to folks around the country who know how to do this. And I suspect that, I know, that over time we're going to get better and better. We'll have more support for you. And we'll just stay in constant contact as we try to make this work. Final reminder, for those districts who have not yet submitted your distance learning plans to the Department of Education, tomorrow is the deadline. To the majority of districts who have already sent their distance learning plans, thank you, thank you, thank you. You did it quickly, you did a good job. We're going to work with you to continue to improve those plans. But to the cities and towns out there, this is a real deadline. The deadline is tomorrow, school's starting Monday. We need you to get your distance learning plans to the commissioner tomorrow, by the end of the day tomorrow. Okay, I'm going to move on to a few other topics. On Saturday, I signed an executive order ordering insurance companies to pay for telehealth visits of primary care providers and behavioral health care providers. It's come to our attention that that executive order needs to be broadened. So a few minutes ago, I signed another executive order broadening the use of telehealth. And I want to be very clear about this. As of today, I am ordering through the State Health Insurance Commissioner all health insurance companies doing business in the state of Rhode Island to pay for all medically appropriate telehealth visits, and that applies to all providers. So last Saturday was mental health and primary care. This is now being expanded. We are learning that, first of all, there are many other specialists, pulmonologists, intensive care intensivists, who are dealing with COVID, so we have to broaden it to specialists. We're also hearing from physicians that it's just not safe for people to be coming into doctor's offices. So as of today, every health insurer is required to cover all medically appropriate telehealth visits of any kind with any specialist, and to cover it at the same rate as you would for the inpatient visit. So I need providers to hear that, and I need patients to hear that, because if as a patient that's not your experience, you need to let us know so we can further enforce it. I want to make something else very clear. In this executive order, we are clarifying that this includes purely telephonic visits, which is to say just a phone call. Of course, you can also use a video component, FaceTime or something, a video component. But what we're saying here is if it's audio only, just a phone call, and you have an interaction with your doctor, the insurance company must cover that interaction in the same way that they would if it were an in-person visit. At this time, I want to give a special thank you to Blue Cross Blue Shield of Rhode Island. They have been fantastic in collaborating with us, helping us to get this right, and also communicating it to their members and to their providers. So on behalf of a grateful Rhode Island to Blue Cross Blue Shield, thank you for your leadership and your collaboration. I'd like to now move on to utilities. We're hearing a lot of concern from folks who are out of work. It's going to get tough to pay the bills. And nobody, I want to be very clear, through this crisis, nobody should have to worry about the lights going off, the water going off, because you can't pay a bill or you're late on a bill. So today, now I'm announcing that the PUC, Public Utilities Commission, has issued an emergency order mandating that all regulated utilities, electric, gas, water, and sewer, cannot be terminated for any reason as we deal with this crisis, other than protecting someone's safety. Obviously, if the gas has to be shut off for safety, that's different. I want to make it very clear to all the people of Rhode Island, the gas, the electric, the water cannot be shut off because of your inability to pay or because you are delayed in paying. We've also mandated that utilities stop sending past due accounts to collection agencies. So you don't have to worry that they're going to send your past due account to a collection agency. And if that starts to happen, you need to let us know. We're prepared to enforce it. The Attorney General has been fantastic through this crisis. He's working in tandem with us and will use his resources to enforce it. we're serious about this. A couple things. There are a few independent utilities, small water supply districts and such that don't fall under the purview of the PUC. The governor's office is reaching out to them one by one. So far, they've all agreed to follow these rules. So what I said applies to all Rhode Islanders. Thank you to the utility companies for your cooperation. Appreciate this and appreciate your cooperation as we go forward. And we expect that you will follow the order as delivered by the PUC. I will say this. If you're in a position to pay your bills, please pay your bills. This is not a blanket excuse to not pay your bills. Most people in Rhode Island can still pay their utility bills, and they should still pay them on time. This is a time for good faith, good intentions, and doing the right thing. So if you can pay them, pay them. If you can't, have confidence that they won't be remitted to a collection agency and the lights aren't going to go off. I want to address unemployment insurance and temporary disability insurance. As you can imagine, the unemployment insurance claims that we are seeing are unprecedented and are skyrocketing. We will pay them all. The Rhode Island's unemployment insurance fund is in very good shape. It is in much, much better financial shape than it was prior to entering the last recession. And I am in constant contact with the White House and our congressional delegation to make sure that the federal government steps in to give us what we need. So that means if you need to file for unemployment insurance, file and have confidence that your claims will be paid. There is, however, confusion among people around when to file for TDI versus when to file for unemployment insurance. A simple way to think about it is that if you've been laid off, unemployment insurance. If your company's still operating, you haven't been laid off, but you're sick on account of corona or quarantined on account of corona, TDI. The benefit for you is higher for unemployment insurance. So I've been hearing a lot of people who have been laid off and they want to file for TDI. Please don't do that. It's not appropriate. It's not what it's there for, and the benefit to you will be lower. A final message to the community. Stress levels are rising, and that is normal. I keep reminding everybody to take a breath. And we're going to get through this, but I don't know how long it'll be. I'm going to be very honest with you at every step of the way. This is months, not weeks. Relative to other states, Rhode Island is faring quite well. But just try to do whatever you can to take care of one another. In a snowstorm, I ask you to knock on the door of your neighbor or check in on someone who's elderly. Today I'm asking you to pick up the phone and do that. You know, we want to limit social interaction, but shoot somebody a text. How you doing? Can I do anything to help you? Call an elderly person who you know. Ask them if they're getting the food and medical help that they need. Mental health, we're overrun with mental health requests. This is a depressing time. It's an anxious-filled time. Unemployment is going to go up. We're going to get through it. We have a great team in place and a plan in place, but I'm asking you to think longer term, put in place your family infrastructure to get you through for a couple months more than a couple weeks. I will say this, the outpouring from the community is fantastic. I know some bakeries and cafes are giving away free bread and free coffee. Thank you, thank you, thank you, thank you. I'm announcing right now that Bradford Soap, which is a local soap manufacturer in West Warwick, Rhode Island, is donating 70,000 bars of soap to the people of Rhode Island, and they'll be distributing that through the Rhode Island Food Bank and Family Service RI. The Catholic Diocese of Rhode Island is distributing Stop and Shop cards, gift cards to parishioners. So take advantage of that. If you need a gift card, if money's tight or money's going to get tight, go ahead and do that. I announced yesterday the Rhode Island Foundation and the United Way have come together to create a philanthropic fund. I've been hitting the phones asking folks to donate. I want to say thank you to those who've donated, and I want to urge any individual or corporation who is in a position to make a contribution, contribute to that fund. That money is going to be directed to the most vulnerable in Rhode Island. I would say, generally, this crisis is hitting, the folks getting hit the hardest are the ones who can least afford to take the hit. So it's on all of us, if we're in a position to be helpful, financially or otherwise, to lend a hand to somebody else, because that's the only way we're going to get through it. And to those of you who have heard me ask for help and who have answered, I want to say thank you. And that includes companies. Yesterday I did a TV program. I said that we needed swabs, and Becton Dickinson called us and said, we're sending you 1,000 swabs. So thank you for doing that, and to all the corporate actors who are reaching out, I want to say thank you. So with that, I'm going to turn it over to Dr. Nicole Alexander-Scott. She's my hero. She's our hero. She's going to take us through the update on the health care side of things. Then we're going to do a little something different here in an effort to practice what we preach. We're asking any members of the press who want to send us your questions rather than coming in person to do that. So the first question she's going to take are going to be the ones that came in that way. And then we'll stay here as long as you need to answer all of your questions. Thank you.